I'm going to talk a little bit about my thoughts on leadership and how it impacts excellence in patient care, research, and education. So this is one of those talks that I would have never came up with myself. Several years ago, a friend of mine gave me this topic to come talk at his annual trauma conference, and he said, "Here, I want you to talk about this." And I called him up, and I'm like, Mike, this is basically a tell us how awesome you are kind of talk. And he said, "Yeah, I know." And I said, "But there's one thing I don't enjoy doing. It's like telling you how awesome I am." And he said, "Well, that's too bad. Do it anyways." I was like, "Okay." And Mike's one of those kind of people you really can't say no to. So it did sort of force me to think about how I do things and why I do things. So I think it is important to start with the premise that real leadership starts with the premise that you want to make things better, right? If you take a leadership role because you want to get more recognition or make more money, you'll kind of go so far. But then eventually it becomes clear why you're doing what you're doing, and then you see people kind of stall out. But if you really want to have important leadership roles, you really have to be somebody who's trying to make a difference and improve the situation. So I got thinking about it, and I thought, well, what differences, did I want to make, right? And so the first thing is excellent patient care. That's the most important thing we do, right? Nothing else really matters after that. That's the most important thing we do day in and day out, is take great care of patients. I wanted us to contribute new knowledge. So this is why we do research and teach, because we tried to improve the care that we give. And then lastly, I wanted to develop a place where people could flourish. And I wanted them to be able to do it in a way that they wanted and not some arbitrary way that I thought they should do it. And so I think this is why we seek leadership roles, is to be able to do these things for people. I thought these are the things I wanted to do, right? Excellent patient care, research and education, and develop a place where people could flourish. And then the question that, as I was putting this together, I kind of struggled with, well, how do I do that? Or, what are my rules? So I realized I have 9 rules that I work by. And I hadn't really thought about it before then, but this finally forced me to write them down and to really think about them. So, the first thing we want to do is give great patient care. So how do you do that? You got to hire good people who care about what they do. You have to build support systems to help them. And you have to have a process to assess what you're doing. So I think trauma center verification process has done a really good job of that. It sort of forces you to do this. And so, you have to do things like, we have a trauma app that has all our guidelines in there. So you can go there and see how we give care, how we think about certain things. And so, you can put systems in place to help people provide excellent care. Again, if you want to do excellence in research, you have to hire good people who care about what they do, build a system to support them, and then have a process to guide or to assess what you're doing. So how many grants do we have? How many publications does a group have? How many presentations? How's the career advancement going? These are all metrics that we'll use to assess how well we're doing in research. And then the hard one is how do you know people are doing well and flourishing? And so same thing, you got to hire good people who care about what they do. You have to build a support system around them to let them do their job well. And then, how do you assess if people are flourishing? That's a harder one. I think our group's done pretty well, right? We have 2 endowed chairs, vice chair in our group, 3 associate vice chairs, and, people with a lot of leadership roles. So I think, some of the data suggests that they're doing well. But again, these are the things you want to accomplish, but what are the rules? What are the guiding principles? And as I said, I really, as I thought about this, I came up with 9 things that sort of guide how I do things. All right, so my first rule is hard work is more important than talent, right? I think I'm reasonably talented, but I think I work really hard. And I think that's more important, again, than any sort of God-given talent you may have. So, and the important thing you have to remember is everything you want is on the other side of hard, right? You're never going to accomplish anything in life without a little bit of hard work. And so I think the most important thing you can do as a clinical leader is lead by example. So I still take regular call, although I'm getting close to ending that. So I can get ready to turn 65 soon. But we'll see. I still do my weeks of call, right? Still, I'm on EGS this week. And I think you just have to be making rounds and teaching the residents, and you have to be up in the middle of the night and be in the OR at 2 a.m. sometimes to see what's happening there and what are the problems and why are cases getting delayed and why can't they, find a ligature at 2 a.m. Like you have to be there to know what the problems are to be able to fix them. This slide was great when Conor McGregor was going around and just like beating everybody up and winning everything, but it's less relevant now that he's like not doing anything. But he does say, right, there's no talent, there's just hard work, there's obsession. So I agree with the last bit there. Like I'm not talented so much as I'm obsessed and with doing well. So, and Ken Calvin Coolidge said, really hard work is the way you can tackle and conquer most problems. So, right, so nothing in the world takes the place of persistence. Talent will not. Nothing is more common than unsuccessful people with talent, right? Genius will not. Unrewarded genius is almost a proverb. Education alone will not solve the problems. The world's full of educated derelicts. So persistence and determination alone are omnipotent, right? The slogan, press on, has solved most problems. So you also have to trust that hard work is its own reward, right? If you're doing something hard work because you expect to get something in return, you're going to be disappointed. So you have to do the hard work and do it as its own reward, right? And if you're just looking for external validation or some reward, you're going to get disappointed. So you just have to put in the hard work and trust that ultimately smart people will recognize your hard work. All right, so rule number 2, integrity is everything, right? So I have like 2 sort of functional definitions. The one I use most commonly is the ability to be honest with yourself about yourself. And this is also probably the most important thing in emotional intelligence, is knowing who you are and what you are. And then the other definition is like doing the right thing even when no one is looking, and it will cause you pain. Okay? So you want to go to bed, it's 3 a.m., but the right thing to do is to get up and go look at that patient again and not go back to bed. So again, you have to, pay attention to what you're doing. So I think the most important thing you can do as a clinical leader is lead by example and set the tone. One of the examples I use is at M&M. Like, we frequently see a case gets presented and very quickly the attending jumps in and tries to justify what they did and why. And sometimes I think you have to just let the discussion go, and if it's appropriate, yesterday at M&M, I said I made a technical error in that case. The patient had to go back to the OR for a leak because of a technical error I made during the anastomosis. And I think you have to step up and say those things and let people know that you can admit your mistakes and learn from them. So again, I love this quote by Lieutenant General Morrison, right? The standard you walk past is the standard you accept. So if you let things go, you're tacitly accepting them and giving that message. All right, so rule number 3 is teamwork is a necessity. Gone are the old days when surgeons did everything and ran this, were the leaders and everybody just did what they dictated. If you're going to get anything done in healthcare today, it's going to take teamwork. And this is becoming increasingly true. So I think for us, we have a great team. We love what we do. We love taking care of patients. We even like training the residents. We like doing research and trying to make things better. And so we have a huge team in acute care surgery in particular, right? So we have our surgeons, which we're up to like 12 or 13 now. I never thought we'd need more than 7 or 8. Now we keep hiring more people, and we just keep getting busier and keep hiring more people and keep getting busier. So, right, but we have great trainees. We have a great APP team, as all of you know. Clinic staff was the one thing that took a while to really build up. It took us a while to sort of get a good crew, but we've got a nice stable crew of clinic staff right now that's really good. And then we have a lot of you will see people from the trauma office who help us run the trauma center, and and all of that. And then obviously our admins in our academic office. So again, you have to hire great people. You have to give them meaningful work to do. I think like this was one of the things that was a little bit of struggle was we integrated APPs into our team. I think one of the first things that happens is they get all the crappy work that the residents don't want to do. And that's not really very fulfilling for them. So you have to figure out a way to like actually give them meaningful work to do. And it took a few years, but I think now that we finally figured out the formula, you see why now that we have great APPs on our team who are really helpful. And then again, you have to give them support and protection to do the things they should do and give them all the recognition and credit when things go well. But the corollary of that is when you have to take all the responsibility when things don't work out. It's never your team's fault. It's always yours. But again, we have like a great team as you see, we keep, as of like today, tomorrow, I have to update the slide because Samong Wang, one of our former fellows, is joining us as an instructor for 2 years. And then we also Mallory Pratt's joining us as well. So we're adding to our team. And then APPs is a little bit old slide. Deb's moved to the recovery room, but we've added Renita. And we have an outpatient APP now as well. So it's a big team. And then, like I say, the trauma office staff is a great crew that we've had for a long, long time. They really help us run the trauma center. So again, teamwork is crucial. So it starts with a good environment. I think for us, we're probably the ultimate team sport in the hospital. I mean, we have to work with nursing, EMED, ortho, radiology, IR, anesthesia, like every day. And you have to be able to play well with all these people and work as a team. And now I also think that, acute care surgery research is now a team sport as it is in most specialties. But again, if you don't have a whole team of people, you're not going to get very far. All right, rule number 4 is you can never stop learning. You always have to be constantly pushing yourself to learn new things. So I sort of do this in 3 ways. I think research is one of those things. It forces you to read, keep current of the literature, find out what questions need to be asked and addressed. I read a lot, which I think is very helpful. And then obviously, teaching the residents is one of the things that will really push you to increase your knowledge. Because if you don't know what's going on, if you're not up to date, pretty early on, the residents will figure out that you really don't know what you're talking about, and they'll call you out on it. So I think these are the 3 things that I think keep you on your toes and force you to keep learning. Or was one of my favorite quotes, John Cotton Dana was a famous librarian, interesting character. Who thought librarians could be interesting, right? He's actually a fascinating guy, pretty much a libertarian and interesting guy. But he said, who dares to teach must never cease to learn. So those of us who dare to teach residents, we always have to be learning and increasing our knowledge. So this is, some of the stuff our group's doing and working on. We have a lot of research projects. As Peter mentioned, we have several grants in our group. Dr. Weiser's leading the LEAP SAVE initiative. Dr. Pugh has her Techie Center. So there's a lot of things going on. Dr. Knowlton and our R01 grant. So, there's a lot of research going on by the acute care surgery faculty. And we're trying to make sure we spread this out and involve trainees. Jeff Choi and others have done a great job with sort of leading resident and student-led research and trying to get productivity out to all our residents and the students that are interested in going into surgery and trying to help them to be both active and productive in the things they do. And as I said, one of my things, I try to read a lot. So these are just the books on your left are my 4 favorite leadership books. Contrarian's Guide to Leadership, Dr. Crummell actually gave me that. It's like one of my favorite books. I'm a little bit contrarian at times. And then The 5 Dysfunctions of a Team, I think was like one of the best books I ever read. And it really set the tone on how teams work and some of the common problems that they have and how to address them. And then The Tyranny of Metrics is another great one. He talks about how a lot of the things that we measure things because they're easy to measure. So a lot of the things that are easy to measure aren't important. And a lot of things that are important aren't easy to measure. So. And then on the right side are meet somebody. On the right side are the 6 nonfiction books I've read this past year. So they're kind of interesting. I really liked Culture Code a lot. That was a good one. So yeah, these are just kind of some of the. This is along with, this doesn't count the fiction novels I've read as well. So, but again, try to read a little something about leadership every other month or so. All right. So rule number 5. This is one of my favorite ones. Multitasking is a myth. When people start multitasking, that immediately means they're not paying attention to something. So it's actually physically impossible for the human brain to be doing 2 things at once. We think we're doing 2 things at once. We are not. We are quickly switching between the 2, right? But you're not doing 2 things at once. Can't. Physically impossible. I think most of the time it's just a half-ass excuse to look busy and important. Right? You're walking down the hallway, you're texting somebody, like, come on. Put your phone away. Like I actually, when I'm walking down the hallway, try not to get my phone out and text and do the daily Wordle thing. That's usually what people are doing. But I failed Wordle today, by the way. So, anyways, today is actually day 997 consecutive days. I do it every day with my sisters and my wife, and anyway, so today's we'll hit 1,000 this week. So, but again, it's just, you should do what you're doing, right? So the Russian proverb, right? If you chase 2 rabbits, you'll catch neither one. So again, I think as a leader, your first thing is you have to be present. Right? You have to have presence. You have to be around. You have to be seen. You have to be out in the hospital. You have to be making rounds. So you have to have presence. But you also have to be present, right? If I'm here and I'm not paying attention, then I'm not really present. So I think you have to be present in doing what you're doing. So my advice, right, is do what you're doing. If you're making rounds, be making rounds. Don't be answering emails and sending text messages like while the residents are presenting to you. Like you have to be present. Same for the senior residents. The medical students are presenting to you. Put your phone away, look at them, make eye contact, right? Pay attention. So do what you're doing, because multitasking just doesn't work. It's really, you're just doing 2 things badly at the same time. All right, rule number 6. This is one that I personally have to work on all the time, which is humility solves most problems. Truth be told, I'm not the most humble person you'll ever meet. But I do think it is one of the rules that if you can keep reminding yourself that you can solve most problems with this. So there's a lot of things you can do if you're humble. So you can listen to other people, right? So humility says if somebody else may have a better idea than me, you can listen to what people are saying. So that allows you to consider new ideas, right? If you think you have all the answers, which I usually think I do, to be honest with you, but you can consider new ideas and listen to others. You can say you're sorry. This is probably one of the most powerful things you can do. I remember years ago in the OR, it was like late, not that late, it was like 7, 8 o'clock. I was trying to get home. Had a case going. I don't know, it was just taking forever. And I got annoyed. I actually sort of lost my temper and yelled at the nurse. And it wasn't his fault, but he was an easy target. He's great, and then I don't know, 10, 15 minutes later, I'm still waiting for the case. And I realized that was a dumb thing. And so I went up to the OR lounge and he was on break and there's a bunch of people in the room. And I just very loudly, very publicly said, "John, sorry, I was an idiot. Wasn't your fault. No excuses." And for years, anytime I needed things in the OR, I just called John, and he's like, "I got you," right? And he became a good friend until he retired. So, saying you're sorry is probably one of the most powerful things you can do. And one of the great rules about saying sorry is that when you say you're sorry, it basically means our relationship is more important than whether I'm right or wrong. Right? If you apologize to somebody, right, that's a way of saying I value our relationship more than whether or not I was right or you were right. So it's one of the most powerful things you can do. And again, if you're humble, you can serve other people, right? You can help them, do things for them. So don't let selfishness and pride take over your agendas. So, be humble and be able to help other people. But again, this is something for me. Some people come by this naturally. I do not, and this is something I constantly have to remind myself about and work on. All right, so rule number 7 is you have to take some risks. Now, I don't mean in patient care. Don't do that. No, be thoughtful. But sometimes, like in your career, you're going to have to make some hard decisions about things, and you're going to have to decide whether or not you want to take some risk. So I think it's important to take some risks, right? Ferris Bueller says, "Only the meek get pinched; the bold will survive." Anytime you can quote Ferris Bueller, it's a great day. But you don't want to be any of these people, right? The VP of no, the VP of status quo, stay the course, idea killer, right? You don't want to be any of these people. You want to right? Muhammad Ali said, if you're not courageous to take some risk, you're not going to accomplish anything in life. So you got to take some risks. Got to be bold. Got to put yourself out there. So when I was young, lived in Kentucky, I always said I wouldn't do 2 things. Number 1, I said I would not practice in California. I just, you guys were all, it's like, people were like, I used to say people in California they were just like granola, just flakes and nuts, And I always said I wouldn't go somewhere and start a trauma program from scratch. I just didn't think I had an interest in starting from zero and in putting together every bit of it. I said, I'll just find some decent place, then go make it better. So then I don't know. I came back after my 3rd visit, and I came home, and I looked at my wife, and I said, I think I'm gonna take the job at Stanford. And she says, isn't that in California? Yes, it is. Do they have a trauma program there? I go, no, not really. No. And she says, interesting. And I'm like, yeah, but I think it's the right move. I think it was a little bold move. More than a couple people called me up and told me I just committed career suicide when I said I was going to come out here. They're like, Stanford's unfixable. It's just, there's just nothing you can do. And even the people here I met, talked about the ICU, the SICU had an average daily census of 4 patients, and we had 2 residents, and there are all these structural issues and problems and things that, on all these reasons why, the trauma program couldn't be successful. And I was kind of I don't buy it. I don't think so, And so, I took a big risk. And like I say, plenty of people thought I was doing something stupid. And just a few times I probably agreed with them along the years, but most of the time not. So you got to be able to, you got to be willing to do something a little wild and not too safe. So, wow, Pete, this is going faster than I thought. We're all right to number 8 already. So part of this is you do have to have some fun along the way, right? You really do have to try to enjoy the journey. And I think for residents, this can be hard. You're working hard, but if you pay attention, there's a lot of fun things that happen every day and opportunities to enjoy yourself. And so, the most fun thing we get to do is operate, right? Get in the OR and take care of patients and have some fun. I don't know, this was some appy I did a couple weeks ago, and I think every resident in the hospital was in the OR. I don't know why, but this is 2 a.m. And of course Kevin's there, but we can make fun of him because he's out on paternity leave. So, but who else is going to have this much fun at 2 a.m? But we get to do a lot of really great things if you think about it, right? I mean, we get to do some crucial things for patients, help them in their time of need, help them through difficult situations, cure cancer, fix their peripheral vascular disease. We get to do all sorts of cool things. when we take care of patients. And you can have a lot of fun if you just remember why you're there and what you do. And then there's all the accessory fun we get to have. Like, so you get to take residents to national meetings and let them present. We got a couple, I don't know, who was it? Yesterday we saw Leon, Beatrice. Who else did I see? Leon, Beatrice. Who else was there yesterday? Justine and Josh, yeah, right? And getting ready to present at next week's American College of Surgeons meeting. But there's several other residents are there too. Ananya and several others are presenting. And so, to get to see residents go to national meetings and present their research and, get some recognition and have some fun, it's a great thing that we get to do. But again, there's all the sort of accessory fun we get to have, right? So we get together and get out, do some things outside of work and enjoy each other's company outside of work. And I think this is something over the years that the program's done very well at and continues to evolve and grow. But again, being a surgeon, you are a privileged person in society, right? It's hard for the residents to imagine, but in a couple of years, you are going to be out there, making hundreds of thousands of dollars, right? And that's going to afford you a lot of liberties and opportunities in life that a lot of people don't get to do. Like, we just spur of the moment, go to the 49ers game and, have some fun there and, you get to have a lot of advantages in life because of all the hard work you've put in. And then for those of us involved in academics, and Dr. Hahn can tell you about this, is one of the best things you get to do is work in national organizations and get to meet some incredible people. So, on the American Board of Surgery, Dr. Goldberg's now the chair of the Board of Surgery, one of my favorite people and a great person to hang out with. And, you get to go to other places and give fancy talks and win awards. And, you get to travel international. This was a recent trip to South Korea. But, the people you get to meet, the acquaintances you get to meet, the people you get to hang out with are really the best part of all of it. It's one of my favorite people ever right here, Dr. Colonel Gurney, who's one of the leaders in military medicine, probably the most badass surgeon I've ever met, and a phenomenal leader, and been a great friend for a long time. So there's a lot of accessory advantages and fun you get to have. This is Will Kethman, who was a resident here years ago, dancing at the governor's ball with Kim Davis of all people. But you get to do a lot of fun things over the years and a lot of opportunities to get out and meet other people and have some great memories and opportunities. So you got to have some fun along the way. And then you also have to realize that someday, things are going well, but you realize that the appreciation from your patients and recognition from your colleagues makes it all sort of worthwhile. So, you get, when things go well and your friends and colleagues recognize you and give you awards and stuff like that. This is all, nice recognition for the work we do. But the best thing is patience, right? And it doesn't take a lot, but it's that the recognition and the thanks from the patient. So this lady, she actually obviously gave us permission to tell her story. And share her pictures and and you'll see why at the end. But so this is a young lady. So she was in a car crash over towards Santa Cruz, came into Life Flight, picked her up, flew her in. She actually had a ruptured diaphragm and her stomach was herniated up. Whoops, where are my slides going forward? And her stomach was herniated up into her chest. And so she had a tension gastrothorax. So we had to take her to the OR, pull her stomach down. And here you see her in the ICU getting better and recovering and did quite well. And then about a year later, she sent me this. And she had written a thank you note to everybody who took care of her, from the paramedics in the field all the way through the hospital, through her rehab, and then back home, and all her family and friends and everybody that helped her. And so she, posted this in the local newspaper and thanked everybody who did this, and then sent me a copy of this, right? And you can see she'd put her life back together. She's gotten in shape, lost a bunch of weight, and really just sort of reclaimed her life after this injury. And so when you get stories like this is just reminds you why we do all the things we do, why we're up in the middle of the night, why we make all the sacrifices and things we do, is so that you can get stories like this from patients who were able to really not just survive their injuries, but really thrive in life. Right? I don't know, what are you doing? Right. But it's Murray Brennan said, right? It's one of these things, caring about patients is, you have to do it. You can't talk about it. You just have to practice it. All right, so final rule number 9 is you always have to remember what your true north is. So anytime there's a problem, a controversy, people are clashing, you always have to just remember what are my 2 most important things, right? And our 2 most important things are, right, excellence in patient care and education. Every time there's a dispute in the hospital, I always my resolution is how does this affect patient care? How does this affect resident education? Everything after that is kind of secondary, not really very important. And so you just got to remember the true north, right? Excellence in patient care and resident education. So that's the only reason we're all here, actually. So, right? So again, I said number one rule is hard work. And I've been fortunate and lucky. I had some great mentors along the way. Probably the most important of which was David Richardson, probably the smartest human being I ever met. Quadruply boarded, but could talk to anybody and always had great advice. And I listened to him. And there are a lot of the things I do, a lot of things that guide me in my career was advice from him. And so I try to listen to smart people, heed their advice. Haven't been 100% at it, but mostly good. And then you have to surround yourself with really good people. But again, you really do have to work hard. And so, right, so these are the 9 rules, right? Jeff Choi made me this plaque. It hangs up in my office. And it really is the 9 rules that I say. But this is, I think, the way you provide excellent patient care, is contributing knowledge and allow people to flourish in their work. And I've been ending a lot of talks with this one slide lately, and it just seems more, more important in today. The world's crazy right now, right? There's a lot going on, and I don't know. It's a little scary right now, and it's easy to get sort of scared and retreat and run away from things right now. But I think you can't be daunted by the enormity of the world's grief. Do justly now, love mercy now, walk humbly now. You are not obligated to complete the work, but neither are you free to abandon it.